So in terms of ovarian cancer across the country, there are nearly 4,000 women diagnosed every year, and unfortunately nearly 2,000 will die in a given year of ovarian cancer. And there are several reasons for that. One is that we don't have an effective screening test that's ever been proven to detect ovarian cancer at an early stage. In addition, because of that, many women, when they are diagnosed, are diagnosed at an advanced stage. So historically, ovarian cancer has been known to be one of the more lethal gynecologic cancers.
Ovarian cancer is really difficult to detect at an early stage. Unfortunately, in many cases, women present at an advanced stage when they start to have symptoms such as abdominal bloating or distension. They may have a change in their bladder or bowel function. They may have shortness of breath. And unfortunately, by the time they start to experience that spectrum of symptoms, they often have advanced stage disease.
When I started in practice in 2001, we didn't really understand the carcinogenic process. We didn't know how these cancers developed. We didn't really yet at that point distinguish the different cell types of ovarian cancer. And the whole scenario now is very different. Not only do we understand that ovarian cancer is really 5 different diseases, but we also understand more about how these cancers begin, and in the fallopian tube, that is, for high-grade serous. And what's more, we have new therapeutic targets that are really changing the landscape and the hope for treatment.
That insight has allowed for some improvements in the treatment outcomes and then survivorship. I mean, the ultimate goal is to get more people into survivor mode. And when you do get people who are surviving, you want that survival to be a quality life. And I think our group has now started to enter into looking at survivorship issues, and I think it completes the research paradigm that is necessary.
The funding is critical. So without funding, the research can't be done, and without research, our outcomes aren't going to get any better. So it is really important that there is attention and expertise invested in trying to improve outcomes in ovarian cancer. So that means research to identify new treatments, specifically targeted treatments for cancer patients.